for heart disease. So the doctor of today needs to be a whole body healthcare practitioner. And hopefully they've been sick before. Because if they've been sick, are they going to care more? Yes. Are they going to listen more? Yes. And what do you want? Someone caring and listening to you. So what are the causes? I have, very quickly, because they told me I only have 23 minutes. So in my book, I go into every single detail. So toxins. If a baby is born in their umbilical cord with over 250 toxins and haven't lived a day, guess how many toxins you have in your body? And if breastfeeding mothers have hundreds of toxins, how many do you think you have? Too many to count. If you look up one toxin and what it does to you, you'd be amazed, but look at the synergistic potential of toxicity. No brilliant Nobel Prize winner would be able to figure out what it's going to do in each one of us. So the cardinal rule is we must detox if we're going to live and thrive and survive today. Bugs, what are we talking about? Viruses. 40% of head and neck cancers or more are caused from HPV. So if the doctor does a biopsy and doesn't look for HPV and treats your cancer without treating the HPV, you're only going to get the cancer back, right? But is there any drug for HPV? No, there is no drug for HPV. So that means you've got to seek nature to take care of you. And that also goes to do with rectal cancers. That's just viruses. Look how many Epstein-Barr, cytomegalo are contributing cause to cancer. Then you have parasites. And you think parasites are only in China and Africa. No, they're right here in your water supply. They're in your foods. They're everywhere. Parasites are very hard to detect because you have to examine the stool within 20 minutes. Now, if you're a really good doctor, you know how to energetically test for parasites. But parasites are real. They can kill you. They can put you in a coma. Discovery magazine had like the case of the month in medicine. It was about patients who were in a coma from parasites. It's real. It's a real big problem. Then you have fungus. Look at the website cancerfungus.com. There's another speaker this weekend, Know the Cause, Doug Kaufman. He's going to talk about it. I'm not going to elaborate. All of us have fungus. Some of it mild, some of it moderate, some of it severe. But you got to address it. You can't take care of the patient and not address the problem. What does chemo cause? Fungal infection, right? Then there's bacterial infections. So there's all kinds of infections that can be in the body, and the doctor must address all of them. Then there's biological factors. Is your thyroid working? What are your hormones? Do you have low adrenal? Do you have low oxygen? Do you have stress galore? Do you have scar interference? So there's all these other factors. So like in our patient chart, we ask, show us on a diagram where all your scars are. You're going to have block detoxification in that area. And then some people, there's 3 phases of liver detox. Phase 1, phase 2, phase 3. Maybe you have a problem in phase 1. So you have to be treated differently than someone who detoxes beautifully. So look at this picture. It's not coming up. Maybe, oh, here. So look. You see this? This is a slide just to make a profound point. This is, you'll see in the beginning on this side, that's the beginning of how cancer starts, and it goes through all those stages. So you think it's that simple to get rid of cancer? You wouldn't even be able to read this. But it's not that simple. But we know that we can prevent it by addressing things from the beginning with each patient and each person. So these are all the stages of tumor formation. It's multifaceted, multi-stage. So These are the hallmarks of cancer. You get an inflammatory nuclear bomb that hits the cell, the growth signals don't work, then you get an immortal cell, and then you get angiogenesis, which is blood supply, tumor tissue invasion, and you've got cancer. As I said, it's a 10 to 12 years, depending on the size of your cancer. So the future of oncology, what is now circulating tumor cells and stem cells. Why? You have remission and or cure if your circulating tumor cells are 0. That's what is in the oncology books today as of 2012. How many doctors are checking circulating tumor cells? None. But it's the future of oncology. It's in their books. I give it to all the patients photocopied in the book where it says when you have remission and or cure. But if something is as big as a line, pencil line, it's already making circulating tumor cells. Everyone knows that the current treatment guidelines are surgery, chemo, and radiation. But as we know, the 5-year survival rate is 2%, and we know that the cure can be the cause and the perpetuating cause. And the bottom line is, it can't be that simple. And do you know that most of the people, I always tell people, that all the people who discovered radiation, how did they die? Cancer. So a lot of the people who are in charge of big cancer institutions have cancer. So that's not a person that you can rely on. That means they don't know how to prevent cancer. Sometimes, though, I won't steer you wrong, sometimes patients need surgery. But luckily, with the advancing stages of medicine, I do a lot of cryosurgery. We have our patients do freezing, cryo, so patients don't undergo surgery, which is neurologically, physically, emotionally challenging to the body, and every doctor should be preparing the patient before surgery and after surgery so that they recover well, right? Doesn't that make sense? Sometimes patients need chemo, depending on their situation, but you can do low-dose chemo. So here's all the different things. So what side effects do we have from these new allopathic protocols? None. You just feel better a little bit every single day. What a concept. Medicine not hurting you. People caring about you. People putting love into your body and you learning how to love back. That's what it's all about. So what is a cancer stem cell and a cancer circulating? These are cells that I told you that are released from the original cancer. As long as something, once the tissue is a millimeter in size, remember that's a pencil line, it's releasing circulating tumor cells. But what we have found is that the drugs, the chemotherapy and a drug called Avastin cuts off the blood supply to cancer. It makes it shrink, and then it has this explosive aspect after the treatment, whether it's Avastin or chemo. So these are this is a Johns Hopkins researcher right here who says that, the patients were given paclitaxel. They make this cancer, they fortify the cancer, allowing the cancer to grow, and exponentially, it's almost like you put kerosene on the cancer. So this is the difference in treatment when you do if you do the chemo or you don't do the chemo. So we all know this, that the cure can also be the cause. Just for example, PET scans. PET scans, which sometimes you have to do to find out what your problem is. If a patient comes in with a breast lump and they have not taken